There's a new imperative now to lower healthcare costs. People are seeking solutions. Providers are, innovating at a furious pace. And one of the focus areas has been on delivering care in teams by using advanced practice providers in new ways in the care delivery system.
I can start with him and see how he's doing.
They've developed a clinic at UPMC that is completely run by advanced practice providers.
The Falk Trauma Clinic is a very unique collaboration between UPMC, the University of Pittsburgh's Health Policy Institute, as well as Pitt's School of Health-Related Sciences. And essentially what we're trying to accomplish here is that patients with a complex spectrum of injury following trauma, when those patients are discharged, they're typically discharged out into the community where they seek out resources that we've set up for them on the inpatient side.
How are you doing, Mr. Marshall?
I'm doing okay. How about you?
What we try to do in the clinic is to consolidate all of those resources into a single place. When the patients are seen, the different groups, the different interprofessional groups will evaluate the patient for their needs, for whether physical therapy or occupational therapy, whether they require outpatient care. In some cases, when patients come in, they may require inpatient rehabilitation needs. Some patients come in with wounds that are difficult for them to heal, and we address all of those needs in one single place. One thing that's extremely unique about our clinic and all of these services that we bring to bear to the patient is that it's done without a physician on site. The nurse practitioners, the physician assistants collaborate incredibly well with the occupational therapist, physical therapist, nutritionist to come up with a care plan for the patient so it gets them back on the road to being good.
And what we're finding is that we're better able to manage the post-discharge care for these patients and do things like reduce unnecessary readmissions and really provide a better transition for those patients as they move back into their homes and the community.
It was really nice to have everybody here in one office with you here. You just have to sit in the office here and everybody's in and out. It's really, really helpful to have everybody here in one spot for you.
We don't want to see patients suffer traumas again and then go back in the hospital because they didn't have needs that we were not meeting in the outpatient setting.